I was looking for the most popular abortion related videos, figuring that those would show the things that people are most interested in. And I found one entitled, How Dangerous Are Abortions for Women? The description: the philosophy of abortion is frequently discussed, but health risks to the mother during the procedure aren't. How dangerous is an abortion? And it's done by Discovery News, so I decided, well, I'm curious. Let's have a look see and check if they actually get into it or not. I turned it on, and the very first sentence that came out of this man's mouth was false. Sounds like Discovery did not disappoint. Mainstream getting it wrong. Let's dig in, shall we?
Under federal law, abortion providers have to tell women of the risk of death in the procedure.
No, there is no federal informed consent law. Does not exist. It's no can do. States can have informed consent laws. Some of them do, some of them don't. And really, I'm not that thrilled with informed consent laws anyway for three reasons. One is that it buys into the busybodies versus woman and her doctor paradigm, which is false. Woman having an abortion is typically up on the table, spread eagled with the sheet over her knees before the doctor even walks in, and she often doesn't even know this person's name. He might not say two words to her, or he might say, "Hi, I'm Bruce. I'm here to do your abortion," like Bruce Steer did. So that's one thing, this paradigm that the woman's actually having an informed consent discussion with her doctor. The other thing is, who the hell's going to enforce it? We saw with Kermit Gosnell, the state doesn't give a damn. You can be having flea-infested cats roaming around, crapping on the floor, people with an 8th grade education doping women to death, and the state can just blow it off like Pennsylvania did with Kermit Gosnell. And number 3, it is so easy to work around. I listened to a tape of a National Abortion Federation meeting where they were discussing what happens when your state comes up with these informed consent laws. And the consensus was that you have the little booklet that the state provides, and you say to the patient, anti-choice busybodies have pushed through this law mandating that we offer you this booklet full of lies and misinformation designed purely to make this decision as difficult as possible and to make you feel guilty. Do you want to review this? The woman's going to say no. So first of all, he's wrong that there's a law requiring that they tell the woman the risk. Second of all, he's wrong that they would tell her the risk. And just look at that smug look on that bastard's face. Oh my God, he looks like Mephistopheles.
Imagine if you had to do that to run a marathon. Just how dangerous are abortions?
You know, that's kind of flippant that he's saying, imagine if you had to do that to run a marathon. Oh my gosh, the idea of having informed consent for a medical procedure. Gosh, how condescending can you be? We don't do informed consent prior to marathons that people have trained for years and years and years and years and years. But oh my gosh, we might treat this medical procedure like other medical procedures. God, what an asshole.
Howdy folks, Trace here for D-News. Abortion is something everyone talks about, but few people really understand. I did a video.
Yeah, he's right. Few people really understand it. And survey says the more favorable a view you have of abortion, the less you probably understand it.
A while back about how they work, so if you need to know, check that out. Recently, the U.S. Supreme Court struck down a law in Texas requiring doctors to have admitting privileges at a nearby hospital because of the purported risks to the mother. But is abortion really that dangerous? Abortion isn't just one thing. It depends on when in the gestation the pregnancy is terminated.
Wow, all right. Gotta give him credit for that. He's not doing the generic lump all abortions in together and, yes, safer than a shot of penicillin.
As you probably know, human gestation is broken into 3 trimesters of about 12 to 14 weeks.
Oh, isn't that cute? They have a little heart to remind you that the mother has a heart, but notice that the baby is missing.
And each trimester presents different risks to the woman. But overall, abortion is not risky.
Yeah, that's overall probably not if performed using high standards of care.
According to a study from obstetrics and gynecology comparing risk of dying from abortion versus dying from giving birth, they found childbirth is 14.7 times more dangerous.
Okay. We have no idea how many women die from abortions. The way the information is collected, and I spent 6 months studying this intensely, calling every vital records office in the United States, talking to the CDC, talking to the National Centers for Health Statistics. What happens is the state health department gets all the data from the death certificates. Then they send a representative sample of that data to the National Center for Health Statistics. If an abortion death is in that sample, then it will go to the National Centers for Health Statistics, and they might find out about it. If it's not in that study, again, they might find out about it, but it's not automatically going to be called to their attention. Now, why would they only might find out about the death if it's on one of the death certificates that's sent? It's because of how the International Classification of Diseases, ICD, coding takes place. An abortion death is a therapeutic misadventure, and they're often going to go through, okay, so she had a punctured uterus and she developed sepsis, and as a result, her liver failed. So she's going to wind up being a liver failure death. And if you go to the cemetery of choice, you'll find lots and lots of cases where there's nothing on the death certificate that indicates this is an abortion. You might have a little check mark saying that the patient had been pregnant at the time of death, in which case it's counted as a maternal death, but not necessarily as an abortion death. So when that death certificate data gets to the National Center for Health Statistics, the abortion is there someplace where the computer catches it, then they will send it to the Centers for Disease Control, and then the CDC will look into it and might count it as an abortion death. And then whether they count it as legal or illegal, they've got their criteria for that. But I've seen quite a few legal abortion deaths. At least the woman had every reason to think it was legal, counted as illegal deaths because of the woman didn't know that the doctor's license was suspended at the time. The woman didn't know that it was actually the clinic owner who wasn't a doctor doing the abortion. So the woman goes in thinking she's getting a safe legal abortion, but the CDC counts it as illegal because of how they do that. So that's only taking a portion. Now, it is possible that somebody else, like the hospital or some pro-lifers who find out about it, will report the death to the CDC and they might investigate. How diligent are they at this? Well, there was a 17-year-old girl in Texas who had an abortion performed at West Loop Clinic by Dr. Robert Christ in 1991. She went home, she died. Her family raised hell, got a very flamboyant, media-savvy lawyer. It was covered extensively in the press in Texas, plus in Missouri, where Christ had had another abortion patient die a few years earlier. The pro-lifers picked up on this, and everything from your little local pro-life newsletter to National Right to Life News was covering it. Somebody probably sent a little shout out to the CDC. The next year, Christ talked about this patient's death at the National Abortion Federation Risk Management Seminar in Dallas. Lisa Coonan of the CDC was present there when Christ was discussing this. We checked with the CDC. Now, they don't say, we can't say, did you count Latachi? They won't tell you that because of HIPAA. But they would give us a breakdown of race and age range, and there were no deaths counted in Latachi's race and age range for that year. So despite the fact that Latachi's death couldn't have been much more obvious as she had crawled to Atlanta and expired on the floor of Lisa Coonan's office with her aftercare instructions clutched in her hand, they didn't bother counting her. So this idea that they're counting all the abortion deaths, that we know how many women died, is completely bogus. It's as if they put a bushel basket under an apple tree And, if an apple falls down and lands in the basket, they'll count it. And once in a while, somebody might walk by, pick up an apple, and chuck it in the basket and count it. But you'd be a fool to think that the apples in that basket were all of the apples that fell from that tree. So anybody who tries to tell you how many women die a year from abortions, they're either misinformed or they're lying. So I'm going to guess this guy's just misinformed. Come
The
on.
risk of death from abortion is about 0.0007%.
Again, we have no way of knowing that.
According to a study in the journal Contraception, this is similar to plastic surgery, dental procedures, or the number of running deaths that occur during marathons.
Doesn't matter because we don't know.
Another study followed 54,000 women who had abortions to track any post-abortion hospital visits and found only 0.87% of women visited the ER within 6 weeks of the procedure, which is great news because half of all women in the U.S., or roughly 1 out of every 4 people in this country, will have this procedure.
Wait a minute, it was 1 in 3 and now all of a sudden it's half? Somebody broke that down, the degree to which they are just ultra bogusing this to make it seem like everybody and their mother, sister, grandmother, aunt, cousins, and coworkers have had abortions. It ain't true. 50% of abortions are repeat abortions, and some women have 8, 9, 10, 11, 12, 13 abortions. When you start putting them in, the how many women have climbed on that abortion table proportion falls.
It's done so often that of 170,000 procedures studied by the Journal of the American Board of Family Medicine, only 0.85% of the procedures required reaspiration, experienced a cervical tear, or got a mild infection. None of those, by the way, require a hospital to treat. Hospitalization incidence was only 0.07%. But there are different kinds of risks for different procedures.
Okay, now I would want to look at these specific studies because a lot of these studies, they get the information from the abortion clinics. How honest are they? Hard to say. The big initial study on abortion safety was called GIPSA, the Joint Program for the Study of Abortion. And they just took information from the abortion clinics' records. And one of the clinics, in fact, the biggest clinic taking part in GIPSA was the Center for Reproductive and Sexual Health. And these were people that got caught charting a dead patient as pink alert responsive. I do not trust abortion clinic records until I've had a good chance to check, is that abortion clinic someplace like, I would say maybe Curtis Boyd or Suzanne Popama might keep accurate track of their complications. I would not certainly count on Kermit Gosnell to be doing that. We knew Crash wasn't doing that. We knew that Inglewood Women's Hospital wasn't doing that. A lot of these places do the post-op reports before the woman ever goes into the procedure room. So these rates, if they're accurate, are going to be for the high-end abortion clinics that actually care about patient safety, and they cannot be globalized beyond the clinic in which that study took place.
97% of abortions in the first trimester are done using something called vacuum aspiration. Don't picture your floor vacuum at home. It is not like that at all. Instead, picture a doctor pulling back on a syringe.
No, the doctor pulling back on the syringe type of abortion is called manual vacuum evacuation. Okay, and it's a gigantic syringe. It's not a itty bitty syringe like it's not like a diabetic is using for their insulin or an addict is using to shoot up. It's a big ass syringe. Most of these aspiration abortions, it's more like the kind of suction machine they use in a dentist to suck the spit out, but stronger than that.
Of the remaining 3%, some are done with drugs called a medical abortion. Basically, a pill tells the lining of the uterus it's time to shed, and the fetus is carried along with it. With these, the risks are also mild, mainly infections, bleeding, cramps, diarrhea, and such. But there are also surgical abortions, where dilation and evacuation takes place. These are usually done in the second trimester, and the risks are greater, but still mild. Here
Yeah.
Again, doctors are mostly concerned about infections, perforating the uterus, or uncontrolled bleeding, all of which are pretty rare. Abortions do carry a small risk for future pregnancies. A 2003 study of thousands of women found there was a slight miscarriage increase of around 2%, but overall, the risk was incredibly low.
That is significantly higher than the risk of death from COVID that we are all on lockdown over. Oh my God, you're not allowed to visit grandma. You are not allowed to have your family over for Thanksgiving because of a 0.3% chance of death. But a 3% chance this is going to cause a miscarriage? Not a problem.
By comparison, smoking during pregnancy increases the risk of a miscarriage of that pregnancy by 11%. The major problems abortion patients should worry about is sepsis. Basically, the aspiration doesn't get all the fetal and placental tissue, which may become infected as the immune system attacks it. And if women have multiple abortions, the risk of abnormal placental movement in future pregnancies does increase.
Wow. I can't believe he actually touched on that. And remember, 50% of abortions are repeat abortions. So he is admitting that with repeat abortions, you might be screwing up the placenta for that wanted baby later.
Although, remember, both of these fall under that overall low risk of hospitalization and mortality. Each year in the U.S., at least 700,000 women will seek an abortion.
700,000? Let me double check on that. I just have a hard time believing it went from 1.2 million down to 700,000. Oh, wow. It is down to 700,000. That's good news.
Charged political climate like we have now, there will always be a philosophical debate, but numerous scientific studies have proven that the risk is low to the woman.
Again, you look at the study, that rate is only going to apply at the facility where the study was done, and then only if it's not the Center for Reproductive and Sexual Health where dead patients are pink alert and responsive.
As long as it is done by a medical professional. If you want to know more about
Follow this channel. There are plenty of unsafe medical professionals out there doing abortions.